Most of us have tried dieting or losing a few pounds, but you know what? Maybe it didn't work as well as you had hoped, or you weren't able to keep the weight off. With us today are two doctors from Scottsdale Weight Loss Center who are here to talk about physician-monitored weight loss. I'd like you to meet Dr. Primack and Dr. Ziltzer. Welcome to both of you.
Thank you.
All right, physician-monitored weight loss. Now, what exactly does that mean?
Our specialty is in helping someone lose weight by using non-surgical means. For example, we'll put patients on a very low-calorie diet. Sometimes we use appetite suppressants, but pretty much any tool that can help someone lose weight that does not involve surgery.
Okay, and this is for anybody. I mean, it doesn't matter if you've got 20 pounds to lose or 200 pounds to lose. Anybody could qualify,
We
right?
start somewhere about 10 to 20 pounds and work up to 200 or more pounds.
Okay.
And we individualize it for each person depending on how much weight you want to lose.
All right, so walk me through the process and set an appointment, come in the door. What's going to happen?
First thing to do is call our office, and we set up an individual appointment with our coordinator, Sheila. And she takes everyone through about an hour-long introduction to the program, introducing which plans we have. Then you set up an initial appointment with either Dr. Ziltzer or myself. And we sit down for about an hour, do a history and physical, and decide which plan works best for you.
You know, we often hear don't start any type of weight loss program without seeing a doctor. How important is it to visit with a doctor before starting weight loss?
Well, you know, many people try unhealthy means of exercising. So, you know, what we've found is that when you have advice by a physician, you'll be most successful. Certainly people can try a modest diet on their own if their doctor says that they're in good shape for it. Before you do any aggressive exercise program, you want to be sure you don't have cardiac disease, that you're in good shape to begin exercise.
Well, because if there are health problems, I'm sure then you would approach the weight loss treatment very differently.
We can adapt it for just about anybody's health concerns. Some people we can be more aggressive on, some people a little less. When you're medically monitored, you can lose 2 to 7 pounds a week, week after week. Historically, our old thoughts were you could only lose about 2 pounds a week safely. And that was 2 pounds a week safely without being monitored by a doctor.
Okay, so what's the typical amount of weight someone can expect to lose, let's say, on a weekly basis?
When people first start in our program, in the first month, they've lost somewhere between 12 and 14 pounds. By about 3 months, collectively, they lost about 30, 32 pounds. When we look at all of our patients together since June, they've lost about 9,000 pounds, which is equivalent to about 2 Hummers.
Wow.
They do it under close supervision, so we're watching them very carefully. We're monitoring their kidney function, their liver function, so that it actually is safe weight loss. We're also putting those types of people on a diet that is very controlled. They're getting the proper amount of protein, the essential nutrients, the essential fatty acids, and a small amount of carbohydrate. And those people actually do lose weight quite quickly, especially if they're being active as well.
So it sounds like there's a commitment to the person who is trying to lose the weight. I mean, is this a weekly visit or twice weekly? What is?
It depends on which plan you start with.
Okay. Or how overweight you are.
Or how overweight you are.
Okay.
We start with probably once a week for the first several weeks, and then about every other week after that.
Wow. Okay. And here's the big question: how do we keep it off then? What happens? What happens to your clients after they've reached their goal?
We know that to be successful, I think of it as like a safe deposit box. You really need 4 keys. One of those keys is a good nutritional plan. One of those keys is to gradually increase your activity to a point where you can keep the weight off, because that's a very important component. Close physician monitoring. And then finally, our patients are attending weekly educational classes. These are run by PhD level psychologists, registered dietitians, so that they're really getting the tools they need to keep the weight off. So they're learning about stress eating and compulsive eating and boredom eating, and they're learning about how to appropriately portion their food, and also learning about the types of foods that will fill them up so that they're not having to eat every hour. Because you know, if you eat, you know, rice and pasta all day long and bread, then an hour later you'd be hungry.
Yeah, exactly. All right, well, physician monitored is really the key. Accountability sounds like that's what you're there for, is to monitor things like that, which makes a big difference for a lot of people.
It does. People are very happy to be losing 2 to 7 pounds a week, week after week.
In a very healthy way. Thank you very much for educating us, because it really is all about education. And if you want to know more, you know what? They have a website. You can go to www.scottsdaleweightloss.com, or here's the phone number. It's 480-366-4400, and they're located at 10210 North 92nd Street in Scottsdale.